afternoon, everyone. Heather Lovell here. The year of 2020 has been one to remember. I am sure you are all aware our world was startled with a global pandemic earlier this year. In the age of COVID-19, we have seen the field of medicine rapidly adapt to meet the unique needs of patients and medical staff. Today we'll be having a discussion with practical nursing student Emily Harvening, who is a strong advocate for the use of telemedicine in the healthcare field. And joining us will be practical nursing student Deanne Smith, who is advising patients and healthcare providers to use caution when diving into the world of telemedicine. Before we start our discussion with these two ladies on Facebook, we surveyed 40 people about their thoughts on the topic with the following questions. 1, have you ever used telehealth? 2, do you think you get quality care using telehealth? 3, do you think money is saved using telehealth? And 4, do you feel your information will be kept private with telehealth? And then our last question, number 5, is what are your thoughts about telehealth? We'll jump to those results. 10 people polled said they liked it, 6 people said they hate it, and 13 people said they don't know much about it. 8 people said they don't trust it, another 8 said it sounds like a way to save money, and no one says it sounds expensive. And one person said that it saved their lives or someone they know. Now, let's discuss some of these topics with these bright women. Emily, Deanne, thank you for joining me today.
Thanks for having us.
Thank you. Before we dive in deeper to the advantages and disadvantages of telemedicine, in our Facebook poll, only 58% of responding viewers said they have used telemedicine in one form or another. Would one of you be able to provide our viewers today with a brief overview of what telemedicine is?
Sure, Heather. Telemedicine allows healthcare professionals to evaluate, diagnose, and treat patients at a distance using technology. With the current pandemic, we've seen incredible growth in the world of telemedicine. Telemedicine has been around since as early as the 1950s. In the beginning of healthcare technology, information was passed along over the telephone. And over the last several decades, we've seen telemedicine evolve to include everything from electronic medical records to virtual healthcare visits.
So, what are the pros and cons of people using telemedicine?
One of the greatest benefits of telemedicine is virtual visits. Virtual visits allow patients to attend a doctor's visit from anywhere at any time. This allows for easier scheduling and takes less time out of the day. To attend a doctor's visit from anywhere eliminates the time needed to drive to the doctor's office and the time that it takes to wait. Elderly people, as well as immunocompromised people, can benefit greatly from virtual visits. By receiving care at home, they are not being exposed to illness and germs in hospitals and clinics. This is especially important with the current season with the spread of COVID-19 and influenza. You can also get top-of-the-line healthcare from rural areas if needed quickly from larger cities and more expert doctors without having to transfer down to the larger hospitals.
So, Deanne, what are your views?
Well, I can see what you're saying, Emily. I do agree that preventing exposure to germs is a huge benefit. However, on the flip side, there could be technology barriers for patients, especially older adults and rural areas. Having access to the right kind of technology and internet might not be possible for all patients. Talking about remote care from rural areas, I see how this can also be helpful and save lives. But what if the rural hospitals just do not have the resources or the talent to do the procedures that need to be done, even under guidance of a top doctor from larger facilities?
Very good points from both sides. Deanne, can you tell me more about the disadvantages?
Sure. Related to virtual health visits, there is the issue of reduced continuity of care. Not all providers offer virtual visits, which could leave patients with the decision to change providers. Changing providers can have negative effects on the patient's care. Their new provider likely won't know the full extent of their history as well as the previous provider. It can take multiple visits for a provider to really get to know a patient, their situation, and their history. This can end up costing the patient more money and time than attending an in-person visit with their usual provider. I would also like to point out that virtual visits may not be practical in emergency situations. Proper care may be delayed, and doctors may not be able to help the patient as well virtually. The patient may not know if it is an emergency situation and use a telemedicine visit. Then the provider may just send them into the hospital anyways due to it being an emergency situation. With virtual visits on the rise, it's going to be extremely important to educate patients and their families on when it is necessary to receive care in person from an urgent care or emergency room setting. Not all situations can be evaluated and treated efficiently online.
Wonderful points, Deanne. Emily, would you share your point of view with us, please?
I agree, you make some great points, Deanne. I would like to point out that telemedicine isn't only virtual visits. Telemedicine also includes the sharing of medical records through technology. Electronic medical records have made it exponentially easier to share a patient's medical record with other physicians at other healthcare facilities. With the patient's permission, their medical record can be transferred in seconds. Allowing other providers to access the client's records will provide a more comprehensive and thorough healthcare experience. A lot of healthcare organizations also offer interactive healthcare softwares. Patients can make their own account, and from there, they are able to view medications, test results, doctor's notes, medical records, and more. This is a huge benefit of telemedicine. This reduces the amount of phone calls coming into the clinic due to patients being able to look up their own information. Patients can also use the software to communicate with nursing staff. Using the software allows nurses to answer each patient when they have gathered all the information that the client is looking for.
Very nice. Well, I know in the medical world that HIPAA is a big deal. On Facebook, 62% of our viewers said yes, they feel their privacy with telemedicine would be maintained, but 38% said no, it would not be maintained. Deanne, what kind of problems do you foresee regarding telemedicine and patient privacy?
Well, as with all technology, breaches can happen. This is especially concerning when it comes to patient health information. For example, earlier this month, hackers from North Korea targeted AstraZeneca employee emails with phishing attempts for login information. And earlier this year, a behavioral and mental health company named Aspen Point sent out notifications to over 290,000 patients, alerting them to potential data compromise. These are just a couple of major issues with telemedicine.
Emily, how about you?
Absolutely, breaches can and do happen. Thankfully, security measures are taken to keep everything as safe and private as possible. Secured servers and encryption are used in almost every medical capacity nowadays. Frequent password changes, while frustrating for the user, are a great way to keep patient information protected. IT departments are constantly developing new ways to further keep patient data safe, especially in regards to telemedicine.
So for most Americans, quality health care is important. Just over half of our Facebook viewers polled, 53%, said they believe they would receive quality health care through telemedicine. But 47% said they would not. For those who are using telemedicine, how would the doctors do their assessments? What would that be a challenge, or how would we work around that?
That's another great question, and you make a great point. Recording measurements like weight, food intake, blood pressure, heart rate, and blood sugar levels either manually or through a wearable device such as a Fitbit or Apple Watch can be used at home and instantly send the results to your doctor for them to evaluate and add to your chart.
So Deanne, can you identify ways that this may not be beneficial to patients?
Sure, a lot of it will still rely on patient self-reporting. While some of these wearable technology devices are convenient, they are not very accurate. Also, there are some reports of wearable devices such as Fitbits eliciting an allergic reaction in some people, and the science is still out on whether or not there are long-term risks that can result from the continuous monitoring. It also isn't possible to do every type of visit remotely. You still have to go into the office for things like imaging tests and blood work, as well as for diagnoses that require a more hands-on approach.
So now let's talk bottom line, cost. So 26% of our polled Facebook viewers said you do not save money with telemedicine, while 39% say you do. Then there's the 34% who just are unsure. Emily, can you touch on ways that telemedicine will save the customer money?
Yeah, Heather. Telemedicine provides quicker care so the patient doesn't get sicker, which ultimately results in more money being saved. It also requires no transportation for patients, which saves money on transport, resources, and equipment that go along. It also saves insurance companies the cost of boarding and caring for patients in larger, more expensive hospitals. When patients can be triaged and treated at home, it means less emergency room visits and less exposure to potentially more dangerous germs as well.
You make some great points, Emily. While insurance companies are increasingly covering the cost of telehealth visits during the COVID-19 pandemic, some services may not be fully covered, leading to out-of-pocket costs for the patients. Patients may also run into the problem where they may not be able to see their provider via telemedicine due to some providers in some states not being able to practice across state lines.
Anything else you can see from the perspective of a nurse that would be either for or against telemedicine?
Great question. As a nurse, it is extremely important to build rapport and trust with patients. In a medical system that relies heavily on written electronic communication, a lot of things can be lost in translation. The therapeutic communication techniques we use throughout our days are hard to convey electronically. Things such as a reassuring hand placed on a shoulder when the patient receives bad news, or sitting quietly with the patient while they go through the grief process. Technology can make relationships between patient and caregiver feel cold and automated.
Emily, what about your thoughts?
Deanne, I do agree that telemedicine can create an impersonal health interaction, but I also think about the wonderful ways technology can be used. Patients in underserved parts of the country and the world are able to have access to world-renowned healthcare specialists at the touch of a button. I think that it is something nurses everywhere can appreciate and get excited about.
Thank you, Emily and Deanne. There's a lot to talk about, learn, and take into consideration about this topic. You two have really opened up communication and gave us a lot of information. Thank you for your time. And thank you, viewers, for tuning in today. Cheers!